Anchor Health allows kids to just be kids in their own home, surrounded by their siblings and their family.
I tell families it's not just about patient's comfort. I will always advocate for what is most comfortable for the family. If it's having them home, taking photos with them, making sure that they have the spiritual and cultural, emotional support, especially around traditions at end-of-life care.
Interesting visit.
Yeah, go ahead.
The hospital environment is great when you need acute medical care, surgery, medications to sustain life. However, most children would much rather be at home with their siblings, families, pets, and others. Look at your eyes here. They get all of the supportive services of the Anchor Health system, as well as all of the disease-directed, life-prolonging therapies that the academic medical centers can provide for them. It was so nice meeting you.
Good.
Good. He looks pretty good. He was laughing earlier. I think he was laughing.
He was laughing all day.
Oh, yeah? As a nurse case manager, I go to the patients' houses and meet with the patients and families. I assess any symptoms that are going on and work on symptom management. In any hospice, and especially for pediatrics, is to always focus on comfort and their goals of care.
Alrighty. Thank you.
Hola. I hear so much love in your heart.
Who's that? Hola, Sunday. ¿Quién es?
I am a child life specialist. I have been one for over 20 years. I help kids express themselves in developmentally appropriate ways, and I also help educate them. It's not often that parents have to deal with a sickness or the dying process of their child. One of the things I do is help parents be present for their child in a way that works best for them.
As a nurturing mother and father, you want to take care of your child at home. We feel very comfortable and confident that we can keep our kids at home.
I have Ivan.
Ron, did you read it?
I did.
How
I
much?
loved it.
Oh, yeah.
The whole thing.
This was one of her first days of school, and I can remember us all being in the kitchen that morning, being so excited for her. Yeah.
Our daughter passed last month. Her name was Violet Yeager. Her passing, although difficult, was made much easier by the fact that we were connected with Anchor Health. We actually found different treatments for her that weren't generally available through the primary care physician. We were able to keep Violet at home a couple of times rather than go into the emergency room for breathing issues because we had a doctor to help write prescriptions and things like that that were required.
There's lots of medical situations that feel really sterile and uncomfortable. Katie's visits were never like that.
Anchor Health folks have called to follow up with us and to provide resources to help with the grieving process, including for our son, who is Violet's older brother.
Bye.
It is an emotional situation, but it's such an honor for me personally to be able to be there during the most tender moments of life. There's so much life in these children and their families, and I get to be a part of that every day.